it became very clear that even if you took out every sign or inclination of the tumor, it comes raging back. And so I have an innovation background, and I realized that the only way to extend survival meaningfully in this population is to understand the disease and target it non-surgically, which is interesting coming from a surgeon, because essentially I'm trying to put myself out of business. I trained with the best brain tumor surgeons in the world, and what struck me was that technically they were the best technicians, surgeons on the planet. However, their patients weren't really living longer.
Of season 6, we are still in Brain Cancer Awareness Month. And we have an amazing guest coming on today. I say that often, I know I do. It's hard not to call these guests amazing, wonderful, inspiring individuals because the work they do is so vital and so important in oncology care, cancer care. We talk about so many different things on this show, and it's not all cancer driven, which is great. But the fact that we're in Brain Cancer Awareness Month, we have to have these conversations. They're hard conversations. They're not easy to talk about all the time, but they're conversations that we still have to have. We need to find better treatment options for brain cancer. And with the climate right now, so much is changing when it comes to funding and resources for clinical trials, and not just for brain cancer, but for a lot of different rare cancers across the spectrum. Funding is the one thing that we can't let go of, because without funding, we don't have the resources, we don't have the labs, we don't have the technicians, we don't have the scientists and the researchers, we don't have the collection of the cells in order to find better treatment options for these different cancers. So it's always important to have these awareness campaigns. It's always important to highlight the work of what researchers are doing across the globe and across the nation. So I'm really looking forward to today's guest. They've got an innovative clinical trial that they are currently recruiting for, and we will be talking to them about that shortly. But ahead of that, it's just amazing to me how quickly the time goes by. Here we are in May of 2026, and I feel like I just started this show last year. And it's hard to believe that it was back in 2021, and that was so far ago. That was so long ago. And it makes me think about how quickly time goes by. I always honor Mike in as many of these episodes as I possibly can. And I wouldn't have it any other way. But to think that it's already been 5.5 years since he's passed, that 5.5 years have gone by. And it's interesting to see how far I've come. I look back at that first season of Game on Glio, and I can tell how hard it was to do these episodes, to do this show. I could see the mindset that I was in, the frame of thinking that I was in, the emotional state that I was in. And here I am 5.5 years later. I have met some wonderful people. I've got a collection and a tribe of individuals, not just on social media, but friends that I've made along the way. People that have reached out to me to say that the stories that we tell, my talking to all of you, the difference that it's made in your lives. I am so grateful for this work. I am so grateful to be able to do what I'm doing for the community at large. It's not a path I would have expected to be on. And yet here I am. Where this path goes, I have no clue. But I love being a medical media storyteller. And that is exactly what this is. It's a creative way to bridge the gap of communication between oncology care, clinical trials, and the patient population. But it's also a way to elevate and raise the voices of those who have no other way of being heard. They're not celebrities. They're not famous. They don't have a platform. And yet their stories are really important, and that matters to me. So, thank you all so much for being part of this journey, for sticking with us, for continuing to love our show, for sharing it with others that you feel really need it. The work of the individuals out there, the work of the patients, the caregivers, the families, the hope filled stories, those in the grief and loss space that are experts. It's just amazing. And it teaches me. And I say that often, but it teaches me every single time. Doesn't matter how old you get, doesn't matter whether you're 60, 70, 100 years old. We should never stop learning. We should never stop being open to learning and gathering new information. The minute we say, I know that, I have all the answers, I know all the information, I don't need to learn from anybody else, that's when mistakes are made. And that's when leaders fall. And that's when we're not doing our job well enough. So, thank you all for being part of this community. Thank you for constantly teaching me and allowing me to be in your homes and in your space and in your lives. It's important to me. So, I am so grateful. After a brief word from one of our amazing premier sponsors this season, we will be sitting down with the CEO of Alpheus Medical.
GT MedTech and Gametile Therapy are a premier sponsor of this season of the Game on Glio podcast. Learn more at gametile.com. Cortana Pharma is a premier sponsor of the Game on Glio podcast, developing highly targeted therapies for brain cancer. Learn more at cortanapharma.com.
Welcome, everybody, to season 6, episode 2 of Game on Glio. As I stated before, we're still in Brain Cancer Awareness Month. It is a really important awareness campaign. We're really excited and just so proud to be working with so many of the individuals that we get to speak with on this show. And who I have sitting with me today is somebody extraordinarily amazing. The work that they're doing is very cutting edge. They have a passion for solving the problem of brain cancer and how to treat it. And so I'd like to welcome him to the show. Dr. Vijay Agarwal is the CEO and the founder of Alpheus Medical, who you guys have heard me talk about before. He's leading the company's mission to redefine treatment of glioblastoma. He's a neurosurgeon by training, but Dr. Agarwal has a deep clinical and scientific insight into the realities of treating aggressive brain tumors and a passion for advancing therapies that improve both survival and the quality of life. And I can't stress that enough because it is so important. He brings over 20 years of experience across neurosurgery, biomedical innovation, and executive leadership. He is driven by a simple purpose: to bring hope to patients and families facing the most challenging diagnosis in medicine. And brain cancer is one of those most challenging diagnoses. So, Vijay, thank you so much for being with us, for joining us today. I'm looking forward to diving into this.
Yeah, thank you so much. I would love to start by saying it really is an honor to be here. The work that you've done in particular in the field is astounding. So all of us who have worked in brain cancer have run across people who have leaned on you for support, and it's grown over the last few years. But I think you were one of the really first adopters in providing an avenue like this for patients to reach out, because it's just a very daunting diagnosis. So thank you for your work.
I appreciate that. I really do. It is daunting. It is daunting. And that's kind of what I want to dive right into that, because your background, it includes neurosurgery, but your passion for this work is just so impressive. And I would love to know what drove you into this career. Why neurosurgery? Why brain cancer?
Yeah, it's they say space is the final frontier. The brain is kind of the final frontier in medicine. I mean, we know so little about how the brain works, its potential, its capabilities, how to repair it, how to enhance it, how to prevent it from getting sick. So I've always been really fascinated with neuro as a field in general. And that kind of naturally led to the career. I love working with my hands. very detail oriented, and I really think the best clinicians or the best surgeons are ones where the characteristics that they enjoy and make them successful in other avenues is generally what makes people successful in brain surgery. And I was just with a good friend of mine over the weekend. He's a very famous brain tumor surgeon, but he grew up playing piano, and he really attributes the dexterity of his hands in the operating room to the music he's created over the years. And so it's an extremely beautiful and tragic field, but one I think there's a lot of hope surrounding.
So, I mean, you touch on that it's hopeful but tragic at the same
Yeah.
time. I know it's extremely hard to do this work day in and day out. So, what continues to drive you? I mean, it's as hard as it is at times. What continues to drive you to do the work that you're doing?
Yeah. So, I've had many years of conversations with patients where the conversation centers on, let's get you to your son's high school graduation. Let's get you to your next anniversary. They'll come to me and say, I really want to make it another Christmas with my family. And so these are the milestones that we've had. But these are the milestones that have really minimally moved over the last 100 years. What other disease have we had where we haven't been able to meaningfully increase the quality of life and the length of life?
Mhm.
And so that really drove me. Like I've always been driven to big problems, and I think there's a real big value in medicine for what we call doubles and triples. Like
Yeah.
diseases that can be cured, or can we manage it appropriately? Very important and done by clinicians much smarter than I am. But I am really drawn to the fields where there's a huge impact and need for growth. And there is no bigger need in medicine than to improve the outcomes in brain cancer.
It's kind of astounding when you to hear you say that it hasn't moved, it hasn't changed in almost 100 years. And in all honesty, when you talk about how patients are telling you, I just want to get to this. I want to get to this Christmas. I have a patient family I'm working with now that was down in New York City. I've been with them for a year. He's 29 years old. He just wants to get to his family, the vacation they do with their larger family this summer. And it bothers me. It bothers me so much that is the only timeline that we have. And we know it's an important one, but 6 months, 14 months, 1 year, 2 years, it's just not enough, especially when you're talking about individuals that are in their 20s, their 30s. My husband was only 45.
Yeah.
That's not a lot of time. And so, I hear you talk about this, and I'm wondering, is that part of why you founded Alpheus Medical? I mean, tell us a little bit about the company and what
Yeah.
drove you to found this company.
Yeah, no, I trained in neurosurgery, just taking a step back at Duke, which is it's an unbelievable and very kind of historic institution in the brain tumor world. And it's hard to train there and not fall in love with the field and the patients and the technologies. And so that's where I really groomed the skills to become a brain tumor surgeon. But I was always reaching out for understanding surgically, how to really push the envelope. So I did a series of fellowships all over the world, Sydney and Mayo Clinic, and all of just trying to understand how can I optimally maximize the resection of these tumors. How can I safely take out more of these tumors and learn these very complex approaches? And technically, it was an unbelievable journey. However, it became very clear that even if you took out every sign or inclination of the tumor, it comes raging back. And so, I have an innovation background, and I realized that the only way to extend survival meaningfully in this population is to understand the disease and target it non-surgically, which is interesting coming from a surgeon, because essentially I'm trying to put myself out of business at some point. And I would love nothing more than, apologies to all my friends, but to not have a need for brain tumor surgeons to do, because I would love to get to a place where we manage brain tumors the way we do diabetes and high blood pressure and those sorts of things. We medically manage those patients, and they live very long, productive, and happy lives. And I trained with the best brain tumor surgeons in the world. And what struck me was that technically they were the best technicians, surgeons on the planet. However, their patients weren't really living longer. So they had beautiful surgeries, and in that time, they usually did quite well. But we weren't really moving the needle with extending life and quality of life beyond that. And
Mhm.
that's where I got really interested and started looking at things that targeted unique aspects of brain tumor. And I think perhaps the one of the most unique aspects of brain tumors is that it's really across the entire side of the brain and potentially the whole brain. And Dr. Friedman at Duke used to describe to patients, brain tumors are like glioblastoma is like opening the skull and sprinkling sand on the brain. How can you be expected to have a brain tumor surgeon scoop out every sand particle? You can't, and that's what makes it come back.
Yeah. It's fascinating that you mention it that way. I've never really heard. I've heard so many different descriptions of brain cancer and how it behaves, and that it acts like a spider web.
Yeah,
That it's very intricate. Using the description of sand is probably the best way to describe it, and I've never heard that before
yeah,
because that really does show and put a fine point on how complicated and difficult this really is to treat. And that is how brain cancer behaves, especially there's all different forms of brain cancer. Glioblastoma is one of the most aggressive and hardest to treat. And
mhm,
so now, when you founded Alpheus Medical, you guys really dove into the science behind breaking through that blood brain barrier. And so let's talk a little bit about that because the current clinical trial that you have going on, it's an ultrasound technology that's being used to break through that blood brain barrier. And it's a trial you're currently recruiting for, and it's one of your biggest drivers right now with Alpheus Medical. So can you talk a little bit about it? And it's just, so that everybody knows that's watching, this is specifically for glioblastoma currently.
yeah.
The hope is to open this up, to other areas. But talk a little bit about how this clinical trial works.
Yeah.
What makes this unique among clinical trials?
Yeah. No, thank you. Brain cancer is just, it's such a difficult, complex disease. And I think you have to attack it from multiple fronts to meaningfully extend survival. So I'm not sure a device alone or a drug alone can single handedly do it. So we've combined an extremely powerful drug with a very, very powerful, safe mechanism, which is ultrasound. And the way that it works for many of the people who have had to have glioblastoma surgery before, their surgeons, a lot of them, the majority of academic programs across the country actually will use a drug called 5-ALA.
Hmm.
And that
Yeah.
drug is FDA approved for use in brain cancer. There are very few brain tumor surgeries I will do without the use of 5-ALA because it has been shown to increase the amount of tumor you're able to come out. So I think it's essentially standard of care to do surgery with 5-ALA. And so that drug is powerful because you drink it in water in the morning. That's it. Very, very safe drug. And over about 6 hours, that drug picks out the brain tumor and starts building up in the brain tumor cells.
So can we just to preface this? So 5-ALA, just so everybody knows, it's almost like a dye that kind of goes in once you drink it. It actually it's like a fluorescent. It kind of highlights where the spots of the tumor is located. Is that how it behaves?
Yeah, so it's a
Okay.
small molecule, and what happens is it builds up in all these brain tumor cells. And if you shine, so when you open up the skull and you shine blue light, all the tumor cells fluoresce like a Christmas tree. It's absolutely fascinating every time you see
Mhm.
it. But now imagine if instead of fluorescing like a Christmas tree, if you could non invasively, noiseless, painless, if you could turn those tumor cells on to undergo cell death, to kill themselves, while leaving the normal brain around there safe. That's what our proprietary ultrasound does. So we actually provide the ultrasound across the entire hemisphere and potentially the whole brain down the road is our goal. But right now we're targeting the entire side of the brain that those interdigitating sand particles are based at. So the way it looks, and I think one of the biggest strengths, other than the data, is that it's a very well tolerated, safe treatment. One of
Mhm.
the reasons people don't use Optune is because they don't want to use a treatment 23 hours a day. Patient
Yeah.
recently told me, I know I'm sick. I don't want to be reminded I'm sick every time I pass a reflective surface. And I think
Yeah.
absolutely reasonable. So the adoption for Optune is extraordinarily low.
Mhm.
And what's great about this treatment is it's done once a month as an outpatient. So you go in the morning to one of our many centers across the country that have it open,
Okay.
drink the drug, same dose. It's the exact same drug the majority of people will have had during surgery. So if you tolerate it, well, it's not a new drug to a lot of people. So it's the exact same thing. You drink it in a cup of water, and over about 6 hours, that drug picks out the brain tumor cells and really starts building up in those brain tumor cells. And we put on our helmet, so we help the centers come. We hit the on button. It's noiseless, painless. People play on their phone, watch a movie, read a book, and over about 40 minutes, the treatment is done and patients go home. And we started this with recurrent brain cancer, which is what a lot of new treatments have to do, innovative treatments have to do for the FDA.
Yeah.
And it's very sad, but the recurrent brain cancer community has very, very few meaningful options that can extend life. So
Yeah.
we started that trial 4 or 5 years ago. We had a patient, just to kind of talk a little bit more about that trial. We had a patient who came to us with recurrent brain cancer. That was the
Mhm.
trial. So she had recurred, not too long after her initial diagnosis, but it was very, very clear recurrence. She came onto our trial 4 years ago. She's still on the trial, and her MRIs look great. So she's 4 years out. So she recurred maybe about a year after her initial diagnosis, and now 4 years into the trial, she's still getting her monthly treatments. So she comes to the center
Wow.
4 years later and gets them once a month. And, one of the stories that she has, for people who wanna see her story, Krista, she's agreed to share her story on braincancertrial.com. She has a
Okay.
video talking about her experience there. And we have a patient, Vinny, who's a long term survivor with newly diagnosed glioblastoma. His video is on there as well. So, people hear from us, but they really value when it's coming from patients because they're not vested. They're just happy to be alive and doing very, very well.
Yeah, and so for anybody who is watching, we do have so Vinny's testimonial along with some animation on how this works is up on our social media.
Yeah.
We will be posting more of their stories and testimonials as we go on. But this is it, you're right. I mean, it's very patients and families want to hear from other patients and families to hear what's worked or
Yeah.
what is working for them. And so to hear about a patient who was recurrent and is doing well. Because usually, if you get newly diagnosed, you go into a clinical trial,
Yeah.
you kind of expect and hope that they'll be doing well.
Yeah.
As they go through, it's very rare to hear of a recurrence and have somebody be doing well in a clinical trial.
Yeah.
So, this is fascinating. So every single month for 40 minutes after 6 hours. So, somebody comes in,
Hmm.
they drink this dye, they wait 6 hours, and then they go into there's a device that's used on them,
Helmet.
on their
Yeah.
head
Hmm.
for 40 minutes. And so that device, so does this ultrasound technology, does this interact with the dye? Or is the dye just helping to pinpoint where the tumor is still located?
Yeah.
And then how is the device? Is it like a vibration? I mean, what is it
Yeah.
doing to interact with? Yeah, like explain that a little bit so
Well,
patients.
I think all of that's accurate actually. So
Okay.
this drug will pick out the brain tumor cells. And then what the ultrasound does is it's noiseless, painless. It doesn't you often hear these terms ablative or focused ultrasound. It's the opposite of that. It's
Okay.
defocused, non-ablative. So it's
Nice.
safe. What we have shown over the last 6 years is it's very safe to the normal brain around the brain tumor cells. It really tends to just irritate the tumor cells that have taken up this drug enough to kill them, for them to kill themselves, essentially. And so the helmet is essentially you sit in a seat, it raises up, helmet goes on. This is kind of an outdated example, and I hate to use it, but in the 50s, when women would put hair dryers on,
Oh
they would
yeah.
go to the thing and they would flip them over. That's how we liken the device to. And, they're in a magazine, and most people end up watching, something streaming on their phone. And
Not
so it's
not
a
so outdated. We still use those
Yeah,
today when we're
not
getting
so
our hair colored.
outdated. Yeah, exactly. Yeah, not so outdated, but I think that's the way to think about it. So you're coming in to get, once a month to get your brain tumor treated. I
Right.
get my beard trimmed once a month, and I do it religiously, and it's like not doesn't inhibit my life at all. And I know that brain cancer patients will do anything to survive.
Yeah.
And so as they should.
Yeah.
And so it was very important for us not just to have an effective treatment, but one that could incorporate with their standard and their life, their quality of life. And yeah, I have like a unique perspective as a brain tumor surgeon. I deal with these patients every day. I I think I have actually a much higher threshold to
Mhm.
offer a treatment or to really endorse a treatment like Alpheus unless I am absolutely convinced, because I don't want to waste anybody's time.
Yeah.
So I'm a founder of Alpheus, but I also took many years before going into humans and proving that this what we think is a very powerful technology.
And it's, so in the patients that have been doing this ultrasound technology in this clinical trial with you, what phase of the clinical trial are you guys currently in? Is this a phase 2, a phase 2B, or is this a phase 1 trial?
Yeah. So we did a phase one trial in recurrent brain cancer. We started
Mhm.
years ago. This is actually so late stage phase 2B
Okay.
randomized control trial for newly diagnosed glioblastoma. So, we've
Okay.
done many years of work to show safety and efficacy. And then now we've moved for this pivotal trial
For newly diagnosed. So
for
that's
newly
important
diagnosed.
too. So
Yeah.
it does open up the door and the option for newly diagnosed patients. And it's, when you think about it, it is safe, it's effective, it's harmless. It's 40, it's a day. It's one
Yeah.
day because it's, you take the drug for
Yep.
6 hours, let it soak in, and then you do 40 minutes of the treatment. I mean, one day a month, and to be given possibly years added to your life. So with the patients that have participated already,
Mhm.
what are you seeing with their quality of life? With,
Yeah.
if they're getting a couple of years, if they're getting 4 years, what are you noticing with the quality of life that they're getting with
Yeah.
it?
Yeah, there's no point in extending life unless it's enjoyable quality of life, because who
Yeah.
wants to live longer if you're in pain and having symptoms? And I think that that's one of the most powerful things about the treatment, which we have called sonodynamic therapy, but it's really drug like treatment, so we call it porphyrin metabolite activation, because you're basically activating the tumor cells to undergo cell death with a small molecule. But taking a step back about how patients feel, before we went into humans, we could have very easily gone directly into humans, but we decided to do a dog trial. And
Mhm.
we didn't implant brain tumors in dogs. Unfortunately, dogs are the only mammals other than humans to get brain cancer. It's extremely sad. We are big animal people. And so we really wanted to prove that the treatment worked, but also be able to help these dogs. The University of Minnesota has the most extensive experience out of almost any center in the world. They've done hundreds of dog brain tumor surgeries, have tried many
Wow.
different technologies through drugs, personalized vaccines, devices, everything you can think of, small molecules, everything you can think of, they have tried there. So we went there and they said to us, we're very excited about your treatment. Our home office is in Minnesota. They'd heard about us. They said we're very excited. However, we are full in terms of new technologies, but we have one group of patients that have not responded pretty much to anything experimental, and that was the French bulldogs. And for a
Wow.
variety of reasons, genetic, anatomic, their survival was less than 2 months after
Oh,
diagnosis. It's
wow.
extremely, extremely sad. So they said, they don't have any other options. We'll give you the French bulldogs if you want, and we'll
Mm.
we'll have a very, no pun intended, short leash. And if things don't look well, then we'll pull you off the trial. We'll pull them off the trial and give them something else. And so we were hoping in the French bulldogs to really extend their life, and we did greater than 4 times in the most difficult to treat population. So I treat brain tumors patients, but I'm also very well known in the veterinary community for dog brain cancer, and so I get emails all day from humans and pet owners as well, really begging for a treatment. But we have a video from our very first patient who got treated, and the owner made a video where she said, I have my dog back. So all the
Wow.
things he used to do as a puppy before he was in pain, he's doing those things now. He's sleeping and farting and grunting and playing and running around. And she does this amazing description about how she feels like she got her dog back. And so for us, it was not just we were making these dogs live a very, very long time, but we were increasing their quality of life. And in Krista's video, and I hope people go in and really hear it directly from the source, she talks about how she's doing what she calls new old things. So things that she used to do in the past were no longer able to do and is now doing those things that brought her joy before. One was long bike rides. She loved that, couldn't do it anymore. She's doing that again with her kids. And, and so I think the quality of life for us has been one of the most striking advances from our clinical trials over the years.
Oh, that touches me. As I'm sitting here, like staring at one of my dogs who's all curled up right now, kind of just laying on her mat, and
Yeah.
it's not something I ever knew. I did not know that this was naturally occurring in dogs and canines. And I've said to you before, and I know many people that are. I'm a massive, massive dog lover, so
Yeah.
it breaks my heart to know that this is something that occurs in them as well. But to hear the impact of the quality of life, and that is, it's so important to so many of the patients that we come across,
Yeah.
and but the extension of that as well. And so, as I think about that, and as we're talking about this and this technology, you're in the phase 2B. um what does that mean? So it's newly diagnosed. How many
Mhm.
patients do you guys need to, or would you like to be recruiting
Yeah.
for this part of the trial, this phase?
Yeah, no, it's a thank you. It's a really good question. And the braincancertrial.com site will allow
Mhm.
people to fill things out. It'll pop it to a team of nurses actually that will call you, and they're medically trained people will go through everything with you. And so it's a great time for people who want to join the trial now because
Mhm.
our clinical sites got activated months earlier than we had anticipated. I think it speaks to the excitement of the investigators, and they had patients already heard about it, contacting them saying, "You have to get activated because I want to get treated." So it pushed the IRBs to work quicker and the sites to work quicker. And so we have a lot of spots that are available. We're hoping to enroll somewhere about 100, 120 patients, somewhere in that range.
Okay.
And we just had a press release the other day. We just started the trial. We have about 10% of the trial already enrolled. And we didn't even have the majority of our sites activated when that press release came back. And so we have now significantly increased the number of sites. We will soon be over a large portion of the country because we really want to make it convenient. We've
Yep.
had patients fly hours and hours and hours every month to do it, and we really wanted to decrease that burden. So we
Mhm.
wanted to make it something drivable, an hour and a half, 2 hours at most, something
Okay.
like that, where people
Okay.
can come in the morning and go home at night and have dinner with their families.
Yep.
And so that was really, really important to us. So I really think if people are interested, I'm always available.
Okay.
Maybe painfully available if people want to ask me. And they oftentimes I talk to patients every day, potential patients, and they're excited about the trial, but they have questions about other things, and I'm happy to give my it's just my opinion,
Yeah.
because I have that training. But the braincancertrial.com site,
Yep.
alpheusmedical.com, you can send us an email. We're extraordinarily responsive. And so we will help figure out what center can screen you and decide you're eligible. So we're happy to help coordinate that.
And I can attest to this because I've actually sent a couple of patients
Mhm.
potentially that had reached out to me for help for patient advocacy. And Dr. Agarwal got back within minutes to this individual. And we do have clinicaltrial.com. We do have that link up on our website, both on Game on Glio, but also our new website, brightlifemediallc.com. It is in there. So you can go in. It's so simple to put in all of the information, to populate it with what you need to, and it will tell you whether or not you qualify. And if you do, you kind of go on to that next phase where you talk to the nursing team, and everybody is just so gracious and so giving of their time. Dr. Agarwal has said, he's very accommodating. He will answer other questions. He's extremely knowledgeable. And so we're grateful for that because I think that's something that sometimes the patient community lacks.
Yeah,
They are missing that piece of, because for the patient, they're one of one. And for a lot of oncologists, sometimes you're one of 300, 400, 500 other patients that they're
yeah,
working with and treating. And so it can be disheartening. It can be discouraging. It can be deflating at
yeah,
times because you're focused on you, and you know that they've got to, that you're, the doctors and the teams that you're working with are also working with a million other people. And so sometimes you feel forgotten or left out. And it's not intentional. It's just not, it's just kind of the nature of the beast sometimes in this field, in this industry. And so to have something so responsive and people that are so compassionate, and we see it time and again with a lot of the guys, a lot of you that we're talking with and that we've been working with, we see that compassion and we see that care. And I'll be honest, in some of the other disciplines, outside of the cancer space or even outside of the rare cancer space, you don't always get that. But when it comes to brain cancer, when it comes to other rare cancers, I'm always blown away at how compassionate and available doctors are, clinicians and clinical researchers like yourself are to the patients whenever they need. And that says a lot about the amount of care and investment you have in this. And that kind of leads to my next question.
Yeah.
What is your hope for treating brain cancer in the near
Yeah.
future? How do you feel? Do you feel that we're on the cusp of a breakthrough that will hopefully get paid? Because there's a part of me that just feels there's a shift. In
Yeah.
the last few years, there's just this shift. And, I don't want to overpromise or overextend
Yeah.
or overdeliver. And at the same time, there's so much more going on right now than there was when my husband was diagnosed 6 years ago. It's just far way above and beyond what there was just 6 years ago. And that blows
Yeah.
my mind. So what is your hope, for this in the near future? What are your thoughts on that?
Yeah, no, I hope my hope is to get this treatment, profound metabolite activation, sonodynamic therapy, our treatment, treating the entire hemisphere out to anybody who wants it. Because, the number one question anybody in this field gets is, I'm not eligible, but can I come on compassionate use or is there
Yeah.
an expanded access? We currently do not offer expanded access in the US, very specifically because I can not quantify the amount of requests that I get for patients. And you don't want to say yes to some and no to. How do you pick whose life you're going to try to save? How do you
Yeah.
do that? And in the dog community, you get owners begging for this as well. And so it's a very, very difficult. My dream is to get this readily available to anybody across the country and across the world. So if you're dying of a glioblastoma in a third world country or a country that's poor, and doesn't have the access to care, doesn't have the brain tumor surgeons, temozolomide's too expensive, there are no radiation centers, those patients just die.
Yeah.
So imagine being able to provide a drug they drink in the morning, a device that's there that people get 40 minutes and then they go home. So my dream is to make this available for anybody with brain cancer who wants to use it. And I do feel that shift. I think you are absolutely right. There is a shift towards hope in this community. And I've done pretty much nothing but brain cancer the last 10, 15 years. And I can feel it. And I hope that Alpheus Medical plays a role in that because hope is a very, very powerful thing. And I'm very excited to be able to offer this for patients. But I feel very hopeful. You mentioned 6 years ago, it's not just the amount of treatments that have increased, it's our understanding of the disease.
Yes.
And so the more we understand the disease, oh, you can't treat it focally, you have to treat the whole hemisphere. It's a diffuse disease, requires a diffuse solution. So we understand the disease better. And the better understanding of disease you have, the better you can attack it.
Yeah. I agree with that. And it actually makes me feel so much better that you've said the same thing because, there's some times where I sit there and I'm like, do I just feel this way because I just want to feel this way because that's what
Yeah.
I want for this community? Or am I really seeing, I mean, I'm boots on the ground. I'm at drug conferences. I'm talking to individuals. I'm seeing changes. I'm working with patients. So, you know, there are times where I question, is this really what I'm seeing, this
Yeah.
shift, or is this just something that I really, really want? And I think it's okay if it's both,
Yeah.
but it makes me feel better knowing that you've said that. And, touching on that a little bit, I do want to ask, along with this trial, so because I get patients that ask me this constantly when it comes to trials, if somebody qualifies to be in the clinical trial,
Huh?
is there any expense to them other than the travel of where they might need to go to receive
Yeah.
this treatment?
So it's very important for us. I personally am not a fan or endorse treatments that require patients to pay and do GoFundMe's, and it just fundamentally is unethical.
Hmm.
And so it's really important. It was really important for us. We've raised almost $100 million for the company. Where does that money go? It's a lot of money, and it goes
Hmm.
towards providing the care for patients free. This
Okay.
is a free trial. But not only that, if you're coming from out of town and you need a hotel, we'll take care of that.
Oh,
If you're
wow.
there and your family is there with you, a lot it's center by center, but a lot of the centers will offer a per diem for lunch for your family that's there the whole day, provide you with a snack, provide you that sort of stuff. So not only is the trial free, of course, if someone is flying in and doing that kind of thing, that cost we just ethically
Mhm.
and legally can't take care of that. But if they want to stay the night before to receive their drug first thing in the morning, we'll take care of it. And if their family needs something to be comfortable, the centers take care of it. And so, I'm happy to be a resource. The final word lies with all the clinical sites and the investigators. It's their
Yep.
responsibility to do it. But
Yep.
one of the things they did push on was, let's make this convenient for the patients and let's make this convenient for the family. So we're going to negotiate for some more funds from Alpheus Medical to be able to take care of these things. And I couldn't be happier to spend the money on those sorts of things.
I'm so glad I asked that question because originally I hadn't thought about that. But as we were talking, I'm so glad that I asked because I think that a lot of patients, this will put their mind at ease.
Yeah.
It's always something, and the insurance companies do cover certain costs for clinical trials, but there are a lot of out of pocket expenses for
For sure.
individuals when it comes to travel or being put up in a hotel, meals, flights, depending on what the clinical trial is. So that's a huge weight that can be lifted off of them. And I know that for the newly diagnosed portion of this trial, this is going to be so this can, if somebody gets accepted into this trial and because they're newly diagnosed, if they're doing chemotherapy, so does this kind of roll into the standard of care that they're going to be doing
Exactly
where,
right. Yep.
okay,
We call it standard of care plus, because
okay,
everybody who comes on the trial will
yeah,
receive the standard of care, the temozolomide. Everybody will get that. So
okay,
they're not giving anything up from the standard of care to join the trial.
okay,
What they'll do is, it's a randomized control trial. So
yep,
people on the treatment group will receive an additional benefit, to hopefully additional benefit to their standard of care. So they do not give up anything. It's a standard of care plus trial is how we like to think about it.
okay. And so, and for anybody that's watching, please understand that this is part and parcel for how these trials work. That we have to, unfortunately, it's FDA. It's a way to also monitor and be able to really measure how effective a treatment is. So there has to be a control group.
Yeah.
There has to be a treatment group. It is just how trials work. It is how they've always worked, but the hope is that you get to a place, phase one is different, phase two is different. When you get to phase three, you're able to move out of this control group and really start giving this to patients that are part of the clinical trial. And the hope is that you get beyond that and then it's FDA approved and
Yeah.
then it's just widely available for people to do. And it takes that control group piece out. But this is how trials work, this is how they function. And so a lot of times people don't know that. Um, the one thing that I will say, and I'm sure you would agree, even if somebody is in a control group, what I have seen through research and the studies and the statistics is that even people who are in a control group or a placebo group for a clinical trial fare much better than
Yeah.
people who are not doing a clinical trial.
Yep.
And there's multitude of reasons for that, but I would think that you would agree that you're still faring better in
Yeah.
a clinical trial even if you are not in the treatment piece.
Yeah, my non-Alpheus clinician view, and how I counsel my patients on other clinical trials is that I absolutely think there is a benefit to being even on a placebo trial. You summarized it perfectly. There are certain steps you have to take from an FDA standpoint to be able to make this available, and our hope is that over time that we could do this trial and roll it quickly, and then be able to offer it to patients with newly diagnosed or recurrent. Or it's important to not deviate or stray off of what the FDA is telling you to do, because they're just trying to preserve the safety for patients.
Yeah.
And so they're very rigid, as they need to be. And it's been great working with them on that. But we are happy to oblige and do whatever is needed to do to get this available to as many patients as possible.
So, with that said, what is something positive that you want current patients, current families that right here, right now are going through a brain cancer diagnosis, that are just finding out about the fact that they're just getting this thrown into their lap? You know, we talk about the near future, we talk about our hope for the future. What is something positive that patients can take away from what's going on right now?
Yeah. You know, it is an extremely daunting diagnosis and a situation to be in, especially the majority of people aren't in medicine to understand the disease and these thousand clinical trials that are out there, and how do we do the drug with chemotherapy. It's just an impossible field to navigate. You can do it. There is hope. And it's just very important not to lose sight of that. You're doing
Mhm.
a great job. Everything you can do to support your family member who has brain cancer. Keep hope, keep researching, and keep gathering as much information as you possibly can gather. You can never gain too much information, and go to resources that are trusted. You're a huge one. Rebecca Devine is a huge one. That Brainy Blonde is brilliant. Musella Foundational, National Brain Tumor Society, Brain Tumor Network. None of these are affiliated with. I mean, we don't pay any of these
Yeah.
people. It's just important to get the word out. So get as much information as you can and make a choice that's best for you and your family. And I'm here and we're here to help you do that.
I love that. And, you know, it's funny that, so, you know, everybody that's watching, they already know Rebecca's already been on the
Yeah.
show. She's our first guest
Incredible.
going into the season.
Yeah.
So, yeah, you know, her story, she is a brain cancer survivor. I mean, she is
Yeah.
currently, you know, we uplift these patients, and we've got a couple of other amazing patients that are 8, 9, 10, 12 years out that are on this
Yeah.
season to show us that it is possible, and to show us what they've been doing to live with. And we have one guest that has an inoperable glioblastoma brain tumor, and she's 10 years out.
Incredible.
And it's just, it's amazing to hear these stories. And so there is such a plethora of resources and places that want to help. And Alpheus Medical is one of them. I think that the clinical trial you guys have, the science fascinates me. That's
Yeah.
why I love doing what I do,
Yeah.
because I can dig into the clinical research, I can get into the weeds of it.
Yep.
And it's fascinating to see how the cancer
Yeah.
behaves with this kind of technology.
Yep.
And the whole purpose is to not only break through the blood brain barrier, but to have that that cell death,
Yeah.
so that it doesn't
Yeah.
proliferate. It's a smart cancer. It's an intelligent cancer. We're getting smarter.
Yeah, that is the perfect. I couldn't summarize it any better than that. And so, we have to get smarter as a field to be able to offer really reasonable options for patients. And we are now on the cusp of really understanding the foundational part of glioblastoma. That's why I have so much hope, and I'm happy to serve as a resource. I want to make brain cancer, high blood pressure, and diabetes. It's nobody wants it, but it'll allow you to live a life and accomplish and do the things that you want to accomplish. And if we could play a role in that, however that is, it would be an honor for us to do that.
Well, I don't think I mean, that's just the perfect, I mean, talk about hope and inspiration, and what a great message. And, you know, being in this awareness month, I mean, there's a lot of drive and there's a lot of information. And so I'm so grateful. I'm so grateful that our paths have crossed. I'm
Too.
grateful that we get to work together to have you on the show to really showcase the incredible research that's being done in the field, and, you know, to give people more resources, to let them know that this isn't dying off, it's not falling off the radar, we're actually just getting
Yeah.
started. And so, and you guys are a great testament to that. For everybody that is watching, we will have the clinicaltrial.com link on our site, on both of our websites. You can go there. We will have the bio information. We will have hyperlinks to Alpheus Medical. if you think that you might qualify, please don't hesitate. Fill out the form, give it a try. Don't write it off before you've actually found out whether or not you qualify. It's an amazing opportunity, and you've got nothing to lose.
Yeah.
So, I am so grateful for you. Thank you so much for your time and coming on the show today.
It's an absolute honor. Thank you for everything you do.
Thank you so much. And we will have, Alpheus Medical is on social media. We do a lot of work with them on Instagram. So please visit them, follow their page, follow us. We're happy to share all of this information. And to everybody that is watching, stay tuned because we will be right back.
This episode is sponsored by Highmark Blue Cross Blue Shield, healthcare that's a better fit for your life right now. Learn more at highmark.com. Here's your Healthy Minute from Highmark. Staying connected to others is one of the most powerful ways to support your emotional well-being. Whether it's catching up with a friend, spending time with family, or getting involved in a local group, those connections matter. Regular interaction can ease feelings of loneliness, boost your mood, and even benefit your physical health. Because life can be complex, Highmark is here to support your health journey, including accessible mental well-being. With our mental health solutions, you and your family can often connect with a therapist in 3 days or less, virtually or in person. Find the mental health care you need, personalized for you, on the mental well-being section of My Highmark.
You've been listening to the Game on Glio podcast, the podcast that is designed to educate, advocate, and tell the real stories of those walking the journey of brain cancers such as glioblastoma and grief and loss. Like what you hear? Share us with others. Follow us on Instagram at Game on Glio Podcast, Facebook at Game on Glio, or visit our website or YouTube channel. You can find us anywhere podcasts are played.